Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this project of study and learning together. Remember to study the description of this video, where you can find a link to free clinical hypnosis training classes with several free ebooks. Hypnosis is a powerful technique with which you can help and improve the quality of life of many of your future patients. Therefore, it is important and necessary to begin with a correct definition of what is direct clinical hypnosis. Hypnosis, that great unknown that despite having been used by the Egyptians in the so-called temples of dream, continue raising infinity of unknowns that lead in turn to infinity of polemics. Hypnosis has suffered and continues to suffer very bad press, associated with fairground shows and occult subjects. It has not been allowed to enter health fields where it could really contribute very positively. Although hypnosis is relegated from certain circles, fortunately, this has not prevented its scientific study has been increasing. Proof of this are the societies that have been formed for its study and the increase of articles on hypnosis in scientific journals of different fields. Even monographic magazines on the subject have been created. Another sign of the acceptance of hypnosis in the scientific field, especially in the academic field, is the increase of courses, masters, and doctorates dedicated to this subject. Unfortunately, the use of hypnosis in shows has disagreed and continues to create a bad image of it. The professionals who work in this field must make a double effort to show hypnosis as a technique, or better said, as a serious science, and supported by an abundant body of literature that shows its great effectiveness. Thus, hypnosis is subject to a certain paradox, because while in scientific circles there is no doubt about its effectiveness, most people in the street and even health professionals continue to place it in the drawer of the paranormal. Only when the results of scientific research on hypnosis are more widely disseminated, both among health professionals and the general public, it will be possible to achieve its full acceptance and incorporation in the treatment of various disorders. There are many pathologies or disorders in which hypnosis has demonstrated its efficacy: anxiety, depression, stress, dishabitation of tobacco, cocaine, gambling, alcoholism, stuttering, phobias, asthma, dermatological disorders, irritable bowel syndrome, IBS, nausea and vomiting in chemotherapy, undergoing stressful medical procedures, post-traumatic stress, dysmenorrhea, chronic pain, lowering body weight, reducing allergic hypersensitivity, stabilizing blood pressure, pathologies of the digestive system, sexual problems, premature ejaculation, anorgasmia, erectile dysfunction, inhibited sexual desire, insomnia, etc. In general, nowadays, its usefulness is accepted in various fields: psychological problems, drug addiction and dependencies, psychosomatic diseases, sexual problems, pain, insomnia, surgery activator of the immune system, in sports, dentistry, pedagogy, study, learning, memory, etc. Far from the traditional and theatrical staging in which an oscillating clock in front of the eyes manages to override the will, a session of clinical hypnosis is more like a pleasant form of relaxation, without ceasing to perceive what is happening around. In semi-darkness, without strident lights, with a pleasant temperature and in silence, the patient lets himself be carried away by the hypnotherapist's voice, until reaching in a few minutes a serene concentration in which the brain is much more receptive to the therapeutic indications and behavior modification. In any case, hypnosis can be as dangerous if its proper use it is unknown, as medicine in the wrong hands, or as valid and effective as a balm with no side effects. In fact, we have all gone through AutoHypnosis at one time or another, when being very focused on task, we lost track of time. Hypnosis is the most controversial, questioned, and at the same time fascinating technique or science that makes everything related to it generate curiosity, desire to know and learn even more about it, both by the general public and by health professionals. However, even though the word hypnosis is associated with the mystical, magical, supernatural, and at the same time also surrounded by myth and especially many misunderstandings, it is clear for professionals who use hypnosis that it is a technique: relaxing, interesting, therapeutic, practical, useful, applicable, beneficial, fast, and effective. Speaking of hypnosis, we have the feeling that it is a peculiar phenomenon of human life that seems to remain in a constant and eternal need of explanation and justification of its veracity and therapeutic usefulness. Nowadays, hypnosis is considered as a technique or therapeutic method of which healthy and excellent scientifically demonstrated applications are known. In fact, in 1958, the American Medical Association officially recognized the therapeutic value of hypnotism. Previously, in 1955, the British Medical Association approved the treatment with hypnosis in dentistry and obstetrics. In addition, the Council of Medical Health of the American Medical Association recommends the inclusion of hypnosis in the curricula of medical schools. Hypnosis is incorporated into the daily work of professionals in research, medicine, psychiatry, psychology, sports, in hospitals, in private practices, in research centers, universities, etc. There are also prestigious associations linked to hypnosis, whose purpose is the training, development, teaching and application of hypnosis. Freud divides the mind into conscious, preconscious and unconscious. For us, conscious and unconscious are not fixed limits. They are not opposite extremes, but are united, related. But rather we understand it is a fluctuating phenomenon, that is to say, one can be less conscious or more conscious. Therefore, consciousness can expand or shrink. To be less conscious is not to have one's mind altered, but rather expanded. Hence, we say that hypnosis is not an alterated state of consciousness, but an expanded state of consciousness. In a state of hypnosis, self-hypnosis, sleeping, even when repeating many times the same task, automatism, etc., we are less conscious than conscious, that is to say, more unconscious. If we compare the mind with an iceberg, we see that the conscious part is the part that is seen, the part of the iceberg that produces from the water. And the unconscious part is the part that is not seen, the submerged part of the iceberg. Therefore, the unconscious is greater than the conscious. Hence, we say that hypnosis is an expanded and not altered state of consciousness. For us, the mind would be the iceberg in its totality, without limits, so that the difference between conscious and unconscious is only a difference of degrees. They are not opposite extremes, they are united, related and not separated and differentiated by the floating part and the submerged part of the iceberg. Within the conscious enters the unconscious, and within the conscious enters the conscious. They are united, related. In a degree of less consciousness, unconscious, the mind is more expanded than in a degree of less unconsciousness, conscious. Hence, hypnosis would be an expanded state of consciousness. Consciousness is not fixed. It fluctuates according to the events that are experienced. For example, if we go from work to home and from home to work, driving every day, this action is automated and becomes more unconscious than conscious. If it is a new task that we are learning, we will be more attentive, that is, more aware of what is being done. Therefore, consciousness is constantly expanding or shrinking. The unconscious would be less conscious and the conscious less unconscious. For we cannot drive a vehicle while being unconscious, but rather less conscious. We should not take unconscious as a totally and radically unconscious, but as less conscious. When one is in a state of hypnosis, one is not totally unconscious, as most are aware of the state they are in. Some are more conscious and others less conscious. It depends on the degree of consciousness and consciousness in which the patient is. All people sleep. While they do, some hear sounds and noises coming from inside or outside the room where they are rest. However, others hear absolutely nothing. They lose consciousness. But some are not totally unconscious. It is a matter of degrees and not of absolutism. That is, of yes or no, of conscious or unconscious. The mind is not divided by a conscious state and unconscious state, but rather by being less conscious or less unconscious. That is, it is a matter of degrees within the same mental state which we call conscious and unconscious. Direct clinical hypnosis. The word hypnosis had its origin in hypno, in Greek mythology. Hypnos was the personification of sleep, son of Erebus and Nyx, and twin brother of Thanatos. Sys, suffix meaning action, process or results of irregular state. Therefore, hypnosis would be a process of results or a regular state of numbing. Definition: direct clinical hypnosis. Hypnosis is a technique that allows us to access the unconscious. By means of this technique, we deceive the patient's conscious, making him or her believe that he or she is going to sleep. In this way, the conscious is inhibited, and the unconscious is disinhibited. Once this is achieved, we work and operate with the unconscious to alleviate, cure, or accelerate the healing of symptoms, disorders, or diseases, both psychic and physical, always respecting the moral codes of the patient. Therefore, hypnosis is a natural state provoked in an artificial way. Hypnosis is a science that should always be used for therapeutic purpose. Clinical hypnosis seeks the healing of the patient and does so where it can be faster, more effective, and permanent. That is, working directly in the unconscious part of the patient in order to alleviate, cure, or accelerate the healing of symptoms, disorders, or diseases, both psychic and physical. Hypnosis, then, would be the key to access the unconscious of the mind of the human being. Direct clinical hypnosis versus indirect clinical hypnosis. The indirect clinical hypnosis, or Ericksonian, appears in the mid-20th century by Milton H. Erickson. Consists of a series of fables or stories that the hypnotherapist narrates while the patient is hypnotized, which then must relate once awake with their problems and should serve to solve them. It is like a metaphor. It consists of the use of words with the purpose of creating confusion, while establishing an indirect suggestion. Erickson used metaphors and stories as an essential tools of trance. Direct clinical hypnosis is a set of exercises clear and concrete, which are combined to seek the best effectiveness and greater power. To seek to remove whatever it is that torments, hinders, and even prevents perform daily tasks with a minimum of normality. The success of direct clinical hypnosis will be the good combination between primary, secondary, and tertiary exercises that compose the main base of the treatment. The difference does not lie in the method or trance induction, since there are as many induction methods as there are therapists. The difference lies in the treatment. This is composed of a series of primary, secondary, and tertiary exercises. These exercises are induced directly and not indirectly. Birth of direct clinical hypnosis. The origins of this new discipline within clinical hypnosis date back between the late 80s and the early 90s of the last century. The precursor of this new modality was me, with the publication of several books, and so we created the embryo of direct clinical hypnosis. Clinical Protocol in Hypnosis, Methodology of Intervention in Direct Clinical Hypnosis book, Clinical Hypnotherapy Collection, 9788493559403. Direct Clinical Hypnosis, Deep Hypnosis book, Clinical Hypnotherapy Collection, 9788493926908. Remember that you have in our publishing house 31 publications registered with ISBN about direct clinical hypnosis. At the beginning, the idea was to do the treatment in a direct way and not in an indirect way, as the indirect of Ericksonian hypnosis does. The trance induction is not important since there are as many methods as there are hypnotherapists. In the beginning, we used to induce trance by a combination of relaxation plus visualizations. Later, we introduced new methods such as complete relaxation hypnosis, CRH, and also the introduction of a key to accelerate the induction process and thus more time for the application of the treatment. But as we have mentioned before, the methods of trance induction are of no importance. In the beginning, we based the therapy only on primary exercises. Later, we improved the primary exercises, where we introduced the whispering technique, the ending, the key, and we improved the exit from the hypnotic state. We also expanded the crisis exercises, where we added extended room, bebet, trapeze, your favorite place, etc. We also introduced secondary exercises, which are those that support the primary ones. and tertiary exercises, which are those that the patient must do at home. In this way, we expanded and improved a lot this new modality of hypnosis, expanding and improving the treatment with the introduction of exercises before therapy. We also expanded the therapy based on hypothermia, adding with it the secondary exercises that induce the elevation of the patient's immune system, and the tertiary ones that are based on the patient's previous relaxation to visualize the systematic reduction of this tumor and the consequent healing of the same. With all this, a new modality is born, a new discipline, a new school, within the clinical hypnosis, the direct clinical hypnosis. Today, I am considered as the creator, promoter, and founder of this new discipline, hypnotherapy. The use of clinical hypnosis for therapeutic purpose, it receives the name of clinical hypnotherapy, inserting a therapy to a patient, being this one in a hypnotic state. There is a direct relationship between easy entry into hypnosis and intelligence surrender. The more intelligent, more suggestible, as it usually lacks fears. The more you surrender, fewer sessions and better results. Contrary to popular beliefs, people of lower IQ are infinitely more difficult to hypnotize, while those of higher intelligence are much easier to hypnotize. This is due to the greater ease of concentration and because they are more likely to overcome fears and reclutants that can block the hypnotic process. Hypnosis and sleep. During sleep, as in the hypnotic state, heart rate, respiration, blood pressure and body temperature decrease. In the dream is dreamed, giving rise to rapid eye movement. REM. In hypnosis is visualized, giving the same phenomenon of rapid eye movement. REM. In nightmares, blood pressure and heart rate rise. In hypnosis, the same happens when we make the patient visualize unpleasant events, as for example, with aversive exercises. However, if we perform an electroencephalogram of a person in hypnotic state, the tracing obtained is not like that one of the dream, but it resembles that of a person awake, attentive, but in a state of great tranquility and mental relaxation. Disorders where hypnosis should not be applied. Schizophrenia. Never apply a relaxation to a patient suffering from a schizophrenia, and much less a session of hypnosis because this could suffer an attack of madness. Schizophrenia is treated by a combination of psychiatric medication and psychological treatment. Bipolar disorders. Hypnosis therapy can improve the quality of life of these patients, but never cure it. Bipolar disorders are treated by a combination of psychiatric therapy combined with psychological or hypnotherapy. Paraphilias. The pure paraphiliac lack effective therapy. Medical, psychological, and hypnoid therapy can be applied separately or combined, not getting practically nothing therapeutically speaking, not even by castration, either surgical or chemical. Patient or client. In psychology, the term client is used more than patient. Within clinical hypnosis, we want to make a differentiation between the term patient and client. From the Latin patior, pateris, passus, sum, which means to bear, to suffer, to undergo, we have obtained the term patient. In clinical hypnosis, a patient would be that person who comes to a consultation and is subjected to diagnosis and treatment. We differentiate between patient and client. A client will be the one who accesses a product or service by means of payment, money. In the field of clinical hypnosis, we prefer to use the name patient and not client, although it is a person who obtains a service after payment. It is also a person with some kind of problems, sick. A sick person would be a person who has altered his normal state of health, who has a disease, a physical or psychological alteration, or both, of health. A disease would be an abnormal disorder of the body, physical or of the mind, psychic, that causes discomforts and alteration of the normal function in the sufferer. Therefore, we believe it is better to adopt the name of patient, since it is a client with a problem or a disorder of mental origin, psychotherapy or physical hypothermia. Therefore, who comes to consultation is a person who has a problem, who suffers from a disorder or a physical or psychological disease. that is to say, a sick person, a patient, and not so much a client. It is before patient that client. It is for this reason that we consider the term patient to be more adaptable. From our point of view, we think that it's more decorous to call patient a person who comes to consultation seeking help to solve his problems, than to call him client. Beginning of the session. Its purpose is to give confidence and predispose the patient to adopt a passive posture, allowing himself to be carried away by the hypnotherapist's guidelines. For this purpose, we count on comfort. It is essential that the individual adopts a posture as comfortable as possible, without discomfort, so that nothing can distract him. To do this, undo the buttons of the patient or skirt, bras and shirts, so that it is from the waist to the neck completely free of any oppression. Get rid of all clothing that may cause oppression and prevent a good relaxation. Warn the patient not to wear clothes that are too tight, that may interfere with the training process or that are a source of tension. It is important the use of glasses, shoes, contact lenses, preferably removed, etc. All these issues should be discussed with the patient, looking for the best for him or her and the outcome of the session. Never add any graduation insinuation that implies loss of confidence or insecurity. Always act with sincerity, kindness and tact. Cover the patient with a blanket, because in a hypnotic state the senses are heightened, and the sensation of colds can increase to limits that impede the relaxation process. In this section, we must consider covering the patient's feet, because it is well known that it is impossible to start a dream with cold feet. The different positions adopted by the patient can be lying on a bed or a divan with arms and legs slightly angled away from the body. A comfortable armchair with arms. In this case, it is advisable to use supports for the neck and feet. Sitting on a chair or stool. In this case, support the back on the back of the chair or on the wall so that the patient does not lose balance. The patient is free to move in the chair to find a comfortable position, but should not make unnecessary or sudden body movements, nor should be he or she talk to the therapist if it is not necessary. Standing, feet together, eyes closed, arms along the body, and forehead erect. The arms extended along the body in such way that they adopt a natural and comfortable posture, and allow us to have access to take them to perform a test or verification. Hands comfortable and loose. Concentration consists in centering all the attention in what the hypnotherapist indicates. For it, we must have an exquisite care in the surroundings, like quiet environment, without too many noises and far from possible disturbing external stimuli. Adequate temperature. The room must have a moderate temperature, neither high or low, to facilitate the relaxation. The recommended temperature is between 24 and 25 degrees Celsius. Moderate light. It is important to keep the room with a dim light. Warn the patient that he or she may have strange sensations such as tingling or floating sensations. These are positive signs that he or she is letting go. Administer relaxation instruction in a warm, low, soft voice at a slower than normal pace. Take as much time as necessary. Eyes closed, although initially you can keep your eyes open if you feel more comfortable doing so, although later you should try with your eyes closed, so that they favor concentration and avoid distractions. Praise the patient for his efforts. It is not easy to let go after several years of stress, so praising and encouraging the patient in an appropriate way will reinforce his efforts and stimulate his motivation to perseverance. Let the mind go blank and pay attention to the background music and the hypnotherapeutic voice, emphasizing that nothing around you exists other than these two things. If you are interested in learning more about clinical hypnosis, watch our next video, What is Classical or Ericksonian Hypnosis? Remember to study the description of this video, where you can find a link to free training classes on clinical hypnosis, with several free ebooks. If you have questions, add them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we will publish. So if you are interested, do not miss our next video. Thank you very much.